We are today so very fortunate to have Dr. Rebecka Lundgren as our Grand Rounds speaker. I am introducing her on behalf of our Grand Rounds organizers. And I just want to say that I have a special place in my heart always for anthropologists, because my journey to public health was actually inspired by an undergraduate professor of mine who was an epidemiologist and an anthropologist. And I just think this discipline and the way that it views our humanity and our being in scholarship is really critical to a lot of the work that we do in public health. So it gives me great pleasure to introduce Dr. Lundgren, who's an associate professor of medicine in the Center on Gender Equity and Health in the Division of Infectious Disease and Global Public Health here at UCSD. She's an applied anthropologist. She has over 30 years of experience in implementation science. Her expertise is in family planning, adolescence, social norms, and gender-based violence. And she puts this expertise to use in bridging the gap between how we do science and how we create effective policy and practice so that we can support the scaling of research and interventions that focus on sexual and reproductive health. She leads implementation research teams of our faculty here at UCSD. She includes our staff and our students alongside global partners to think about how do we identify and scale some of the promising public health programs that she's been involved with. Her funding opportunities have been through USAID, the Bill and Melinda Gates Foundation, and she has a project called Growing Up Great in Kinshasa, Real Fathers in Uganda, and a 5-year Global Agency for All project that you all heard a little bit more about last year that seeks to develop local conceptualizations and measures of agency and how we increase understanding of how to increase agency through social and behavior change initiatives. She's building the evidence on the relationship between one's agency and health outcomes. So thank you so much, Dr. Lundgren, and I'll turn it over to you.
Thank you, Cheryl. I'm really thrilled to be with all of you as a fellow public health practitioner. And I've met a few of you, but not most of you. So I'm really excited to be here with you today. So I was going to talk, I thought about, sharing some of my research, some of my really cool findings on social norm or adolescence. But then I decided to do something a little bit harder, which was to really take this opportunity to reflect over, the 3 decades thus far of my career and how it interacts or intersects with some of the emerging trends in global health. So that's what I'll be talking with you today about. And we're going to start talking about this a little bit about global health and power. Then these kind of very common buzzwords of decolonization, localization, diversity and equity, move in a little bit into implementation science. And then I want to get to sort of the nexus of those, how I see these concepts of decolonization and implementation research, mixing together, emerging. And then probably the main part of my presentation would be, or time with you, would be talking about, how do we do this work together? How do we do, what are some of the tools and the pathways for building more equitable partnerships in our global health work, and applying that a little bit and reflecting to the lens of my career and the projects that Cheryl mentioned. So a lot of the individual information I am going to be sharing with you may not be new to, and will definitely not be new to all of you, but what I'm hoping to do is pull them together in a way with a particular point of view, and how to make these kind of ideas more practical and put them into practice. So with that, I wanted to talk a little bit about myself. As I'm sure you all know, a key concept or a key element of decolonization is recognizing, our own positionality. So I thought I could talk to you a little bit about myself. I grew up in San Diego. I'm often one of the few people in rooms here who is a San Diego native, but my undergraduate degrees in anthropology. I went to school at college, and my master's in public health is at UCLA. So I'm also a very proud UC graduate. After that, I spent about 15 years of my career, the first very formative years, in Latin America, in Guatemala, El Salvador, Honduras, where I did what used to be called operations research. I worked with an organization called the Population Council, which some of you may know. And at that time, really a lot of their expertise was in what we would call service delivery research or applied research, trying to test new strategies to improve programs. So I was, very kind of, I think, well trained by that team. And that was definitely my focus for most of my career. After about, 15, 16 years, I was recruited by Georgetown University and I was kind of ready to leave. I was in Honduras at the time, had small kids. I was ready to work in the United States for my first time. So came back to Washington, DC, where I continued doing operations research, mostly for USAID funded programs, but also Title X, also population affairs, working on male engagement, expanding contraceptive choice, and expanding my, moving on to the Philippines and India and other parts of the world at that point. So I did that for, another 10 years or so. And then my director of the center where I worked, which was the Center for Institute for Reproductive Health, they convinced me to get my PhD. So my PhD is in applied anthropology. And that was really exciting. I really moved into more work on social and behavior change. I had some new theoretical models, some new tools that I was able to apply, social network approaches, more ethnographic research. So I started leading projects that were more about adolescence, violence prevention, gender, and moved in a lot more into work in Africa. So I worked a lot in Uganda, in Benin, and in the Democratic Republic of Congo, and a little bit of research in California, but from DC. So about 4 years ago now, I moved here to the Center on Gender Equity and Health, because you'll kind of see the thread going through all of my research has been gender. And I'm very passionate about gender and was very excited to come here and join a team of sort of like-minded individuals. So that's kind of where I am so far. I think that gives you a little sense, not a very academic training. I did most of my career, I became better known in the field with just a master's. I remember when I interviewed for the job at the Pop Council, they said, well, what do you expect to do for us if you don't have a PhD? So I spent about 20 years of my career without a PhD, and then very late in life went back to that sort of more academic perspective, and have been always trying to merge them. So as you know from the title of this presentation, today I want to talk about power and global health. And we all know that power is always present in our work. It's impossible to eliminate, but sometimes we don't recognize it as much as we should in our research partners. So in our research partnerships. So I'm just seeing that there's can you hear me? Does that help?
That does help a little. I've noticed that sometimes your mic goes up and down, and maybe that's causing.
Okay, I don't know why that is, but let me try to just speak. Maybe
That's better.
Flag me if it does again.
Okay, thank you.
I do sometimes have that problem. So I wanted to start with just a quick look at who holds power in global health. And this slide, the takeaway here is that only 7% of the global health organizations are located in Africa. The majority, of course, are in Europe and North America. So that's certainly a concern. Similarly, the majority of leaders of global health organizations are male, 7 and 10 of the leaders on this slide. Then I think especially relevant for us is thinking about the diversity in leadership in terms of, where our leaders are coming from. So, over 83% of the global health leaders come from high income countries, with only 5% from women from lower and middle income countries. So, I think we all know that's a problem and we're all working to address it, or some of us are working to address it. And then I also thought this statistic is interesting that, 8% have degrees from Harvard, which is the same amount as all of the degrees from the rest of the world combined. So, something not a surprise to any of us, but kind of a background of one of the ways that power is manifested in our field. So, we know that sometimes we think about global health or health in general as a very idealistic field, that, we're all driven by our values, our principles, our vision, but we also have our own sort of power-related issues. We want global recognition, perhaps, leadership, job security, advance our own economic or national interests. So it's just something that I think is always worth reminding, everyone in the field, including our students, that, this is, power and privilege is an important part of global health. And, we draw on all these different forms of capital to position ourselves favorably. And part of the decolonization efforts is to take note, who has different kinds of capital and who doesn't, and what can we do to make the field more equitable. So a really important part of this is knowledge. What kind of knowledge do we value and who produces it? Especially working at a university, I definitely see, a lot of emphasis on certain kinds of knowledge, which may not be the knowledge that some of our stakeholders or our partners are really looking for. I know we have a project that Cheryl mentioned, our Agency for All partner, and as we were developing the kind of the results framework for the project, and we were putting in certain kinds of indicators of equity and local leadership. And one of the areas that our local partners from Africa, India, and India really wanted is they wanted to have a lot of input into the types of research methods that our project uses, because their concern was that it's all going to be RCTs. They're not going to provide the sort of nuanced implementation process data that we need to improve our programs and guide our policies. So we were, the researchers kind of feel like we are the scientific arbiters on this, and we know what research methods are best. So just an example of how kind of that interesting intersection about what knowledge is valued is something we need to keep in mind. We know it's not possible to eliminate power from the global health field. Scientific methods does not do it because we're still selecting the questions, selecting the methods, so there's still power. Even as scientific as we try to be, we have to recognize this. And we often reinforce sort of dominant stories or dominant narratives by the things that we choose to research and how we choose to research them and communicate them. And all of us, as researchers, practitioners, language is really an important part of our source of our power. As writers, scholars, it's the currency that we use in our daily life. So, as you know, even the term global health is criticized as a construct because it excludes diversity and local difference. So one of the things, we need to do is think about how we do wield power through the language we use. And just a little example here from a research by Jennifer Johnson Hanks. It's old research, but it was very illuminating to me. I work, as I said earlier, in reproductive health. So there's sort of a discourse that women don't use contraceptive methods because they don't have the right access or they don't have knowledge. And we sometimes undervalue what's really going on. And in this study, what Jennifer found was that there was an issue. Bedi women were they were using periodic abstinence, which for them, they considered modern, discipline, and educated. So there was a real disconnect between what the policymakers, the researchers, and the programmers thought was the problem and what the actual reality was. So kind of just an example of how we can buy into dominant narratives and miss what's really going on in the communities where we work. So a common critique is this focus on positivist logic and research priorities that often dominates and reinforces some of the power elite here. And so what we're trying to do is really think about, sort of challenge that idea that positivist social science is value neutral, and remember kind of what it's rooted in, and remember it's sort of the patriarchal power relationship that it's setting, with of course not throwing it out. It's very important, framework. And try to think about, other sources of knowledge and understanding, which we'll talk a little bit towards the end. So just in sum, we know power is everywhere, and decolonization calls on us to recognize that and to address it. So these are very common, buzzwords in global health, and I think also in other kinds of health practice here in the U.S. So think about these three concepts, as siblings. Diversity, equity, inclusion, and accessibility are, a sibling to both decolonization, which is trying to transform our entire sector, and to localization, which is more about, transforming leadership roles. and thinking about that, in terms of long-term investment. This next slide has just a few of the critiques, I guess, that decolonization is trying to address. Issues where our partners don't have the power to set the research agendas. They have limited access to data or publications. And we sometimes fund programs or projects or research in a way that undermines, local infrastructure. So just a kind of a reminder here, what is decolonization? So as global health was born out of, European colonization with extractive methods of capitalism, racism, and sexism that were used for the colonial powers to hoard their power. And as we all know, the lasting harm that's caused. So decolonization is just trying to think about how those processes shaped, what we now call global health. Localization is really the process of changing policies and process and staffing and funding to equitably transfer power and resources to global South actors. My major funder has always been USAID, and right now this is a big focus of their funding, as it is among a number of foundations that we work with, Hewlett Packard, others. They're really looking at how to shift funding and power to local organizations, away from northern academic organizations. And then diversity is really about maximizing inclusion of individuals in a way that we respect people's individual differences, their types of experience, their lived experiences, and try to interrogate that to address power imbalances. In global health, one of the things we often do is rely on, sort of elite dominant researchers in the field that are well known, that are very culturally competent with dealing with, global funders, and ignore, others who also have great ideas and, research skills. So I'm wanting to move on to implementation science, which is something I'm sure you're all pretty familiar with. So, the idea is that, we're trying to address the no-do gap. There's sometimes a general feeling that if you publish, then the problem will be resolved. I always talk about a time when I was in a meeting with a bunch of researchers, a bunch of practitioners, and we were trying to prioritize our dissemination funds. The researchers really wanted the money to go to peer review publications. The implementers wanted rapid briefs and other kinds of guidance. And I asked the implementers how often do they read peer review publications, and they said very rarely. They rely on other kinds of knowledge to guide their programs and their policies. They maybe don't have access to them. Maybe they're not in the language they seek. They don't have time to read the literature. So I think there's a little bit of a, assumption, a gap or a lack of assumption that if we publish our knowledge, which is of course extremely important, that it will really get put into action. And people always quote this one statistics that I'm sure you all know, that it takes 17 years for 14% of the research to translate into practice. I don't know if that's still the case today, but we do know there's a significant gap in moving things to practice. So this slide, just a few definitions of implementation research, implementation science, which are slightly different things, but for this presentation, I'm just talking to them about them both in terms of trying to move research to application. And that's really, sort of the big goal here. This slide shows some of the definitions of implementation research and science from USAID, from PEPFAR, from NIH, from WHO. But you can see, they all have in common, they're systematic, they're looking towards integrating and applying research findings. And that's what I want to talk about in the light of, decolonization. So there's a lot of different research designs. I think any design, depending on how it's used, can be implementation research. But bringing those two areas together, I think what's made me really reflect on how if you're really doing implementation research, the decolonization part should go hand in hand. I don't really see that divide as much as you might think. Because, for example, here you see this arc of implementation science, which is showing some of the common outcomes of implementation science, understanding feasibility, acceptability, getting an intervention adopted, understanding coverage, getting sustained change. None of that could be achieved well without equitable partnerships and local leadership. And on this slide here, I'm just really looking at, how that nexus works. So if you see here that the purpose of implementation research is to inform decision-making, to improve programs, understand and improve research utilization, all of that depends on having, more equitable relationships, prioritizing local knowledge and needs, having stakeholders involved in this entire. So if equitable partnerships are the cornerstone of successful implementation research and a critical component of decolonization, we often accept that, but forging those equitable partnerships is very hard work. The last semester, I guess, of the last year, there were a lot of global conferences. There was one on social and behavior change, one on family planning, one on violence prevention. All of those conferences, people focused on decolonization and equitable partnerships. But as people left those sessions, those panels, there's always the feeling of, yes, we all agree, but how do we do this? We need to move on to more practical, advice on how to do it. And often when we talk about partnerships, we forget to really consider those deeply embedded power relations and power structures, which is why some of the tasks here on the slide are talked about so often, because we really need to have that interrogation, that discussion, those questions within our teams to acknowledge, what is the role of colonization, what are our colonizing roles, and how can we address them? Those conversations are not easy, and there's, a number of processes that we often use as anthropologists, as other kinds of researchers, to help understand the world around us, collect and interpret data. And all of those can help us with decolonization. Probably most important is, self-reflexivity, to really understand that, we're all swimming in these hierarchical, patriarchal systems, and it's very difficult to see them. It's the water that we swim in. So it takes this process of reflexivity and communication to acknowledge and understand these deep structures. And then also, understanding that goes hand in hand with good listening, with cultural relativism, understanding and empathy. One of the decolonization handbooks just says something very simple. Do you understand what the regular day is for your partner? You understand, what it's like when they go to work? How do they go? What kind of structures they have at work? What assets do they have? A lot of researchers I work with work for a university, maybe like Makerere University in Uganda, but they also have their own consulting business because the work that they do at the university doesn't pay them enough, to maintain their family. So just really trying to understand, our partners is a big part of this. So in equitable partnerships, there's, I've sort of found or kind of thought about 6 domains that are very important in achieving equitable partnerships. And of course, these are not only important for global health. So, and by thinking about these domains, trying to achieve reciprocal rather than transactional partnerships, is really our goal. And remembering that some of the work on equitable partnerships kind of treats it as a very technocratic approach. And there certainly are technical aspects of it, but it's also very much a relational endeavor. So the first domain is about leadership. So really some of the characteristics of leadership here, rooted in, transparent, inclusive decision-making, balanced power and decision-making, all of those things that we know make good leaders. And I wanted to talk for a moment about this project that Cheryl mentioned, Agency for All. So it's a 5-year USAID funded project. We have 13 partners. UCSD, of course, is the prime. The rest of our partners, we have 2 global partners, the rest are local. And one of the objectives of the project is to amplify local leadership. And we've really been struggling with it quite a bit. This is the management structure, not that you need to diagnose this. I'm just saying, I just wanted to show a few things about the management structure. So the first one piece of it is USAID has key personnel. So we did bring on key personnel from other organizations, and one of them is from Uganda, something that's not usual in a USAID project. Usually your key personnel are from your own organization. Another thing we tried to do, or we have done, but all of this is challenging, is develop a leadership team, which has our local partners on it, to have local partners co-lead our results areas, and then develop what you see here on the right of the screen, our hubs, so that all of our research will be taking place in sort of an ecosystem where we bring together researchers, universities, stakeholders, policymakers to advise, participate, learn from that research. Lots of challenges, which I'll discuss towards the end if we have time, but just an example of the kind of things we have to grapple with in terms of partnerships. So this slide is showing some good partnership management practices. Our biggest challenge for us in this project is the kind of continual synchronous and asynchronous partner communication, building in metrics so we understand how well we're doing. Like we're doing a pair study now, so people can talk to each other about, is there equity in these partnerships? Where are the problems? So trying to assess that in an ongoing way. And sort of just for fun, I put up our time zone calendar here. So, we have partners across these different time zones, and it's an simple, obvious, but ongoing problem to have equity in when we schedule meetings, so that not everyone is having meetings, off times for them. Of course, the core piece is amplifying our partner voice. So you can see co-creation, co-review, setting up systems where our partners get to set the agenda and not just, implement the research that we give them or we design. An example of this is a project we have here at GH, which is a social norms learning collaborative network. It started out to be founded by the university I worked with before, Georgetown University. We started developing these learning collaboratives. Now we've gotten to the point where there's 5 different regional ones, and they've now developed sort of a connecting network and coordinating committee, and starting to move the funding directly to that coordinating committee and to those organizations, no longer moving through the university. And their goal is really to share and generate knowledge together and improve their networks. So you see here, this is an evaluation we did where we were looking at were the networks within those communities strengthening, especially academics and the researchers initially were very isolated from the policymakers and the program implementers. And we were trying to tighten, and the funders were isolated from the program implementers. They were more with the researchers. So trying to, build those linkages. Bridging capacity, a lot of capacity strengthening where we can learn from each other to improve partnerships. And, this is probably the toughest one, which is strengthening the research ecosystem. As you all know, there's a lot of challenges in our kind of in the university setting where, where there's over attribution to first authors, rather than to the team. So how do we get our local partners as first authors? And what does that mean for us in the promotion systems at UCSD? How do we manage these kind of equitable team science partnerships in a way that is consistent with a very, traditional and understandably hierarchical system at the university? Academic ranking systems, publishing, intellectual property, all of that are areas that need a lot of work on if we're really if universities are able to be very effective implementation research partners. Equity in finance and management. So another really difficult, question. Just things like how overhead costs. So a lot of our partners don't have federally agreed upon overheads, so they do what they call de minimis costs. So they get 10%, as opposed to global or US-based organizations that get 40 or 50% overhead. So a lot of our partners don't have adequate costs to support the research that they're doing. They don't have the adequate structures to do it. And I was in a project with a university in Nigeria, and they wanted to use our money to buy a refrigerator and to buy signage for their offices. And yeah, I'm a little embarrassed to say when they first came back with that, I was like, oh no, that's not going to help our grants. That's not going to get us to our objectives. But thinking about it now from this lens, they couldn't ask for overhead, and they needed those things to make a kind of a comfortable, effective workspace for them. So a lot of issues, of course, around finance and management. USAID is putting in a new policy where 25% of their grants are supposed to go to local leadership. And a lot of people and funders in Europe find that pretty shocking, that it's so low. It's not even 25% at this point. Like in Agency for All, 60% of our funds are going to local partners. But it's, it's quite a challenge to manage that, for us to manage that in our system. So finally, some of the challenges, I think they're really big challenges, and they're ones that, we have not definitely resolved, but this tension between how to meaningfully do this work to decolonize partnerships, but still maintain accountability to our funders. How far, how much can we frame our ideas of efficiency, which may not align with the ideas of efficiency of our partners. So, and then of course, all of our partners have different organizational incentives and structures. So these are things that would be helpful to think about, to talk about. I certainly don't have an answer for those right now. So I tried to think a little bit about, I took 3 projects that I've worked on and these 6 domains, to try to understand, how well are we doing and where are the challenges? So, I can see in terms of leadership, some of my projects have been very much university-led, top-down. Some of them have started to shift to a local partner. This one project, we were the prime and now they're the prime and we're their evaluation partner. That's a very exciting shift, and it's a grant from the Lego Foundation for 5 years, a very large grant. So, but now our previously partner, we're the sub to them. So different leadership models, such as trying to have local leadership in key personnel positions, but also has challenges. In terms of management, I think the most interesting thing to me is that I have never before had metrics in my partnerships measuring equity. So I've never evaluated ourselves. I've never set transparent goals for what that looks like. That's something we're trying to do in Agency for All. In terms of agency and voice, I think most of my career, the research has been designed by the university or the Northern partners with local researchers and brought in to comment on it, to implement it, to maybe collect the data, participate, but definitely not usually led by our partners or co-created. So I think that's definitely something, I have 30 years of history, so that's definitely things that are changing in our field, but we probably still have a lot further to go in that. In terms of capacity, until this project, I've never really formally thought about capacity strengthening of our partners, and whether it be in finance or whatever areas needed, or having them train us. So I think that's something that's newer for me. Partner ecosystem, a big issue for partners is direct access to funders. So that's changed in different ways. And now in Agency for All, they do directly access, meet with our funders in our monthly meetings. Local authorship, I think my projects that's always been good. We've had local authors on all of them. Equity and finance, it's a big, I don't think we've cracked that, not in any of the work that I'm doing. So I wanted to end up just by a few reflections on a particular research project, applying a little bit of a critical lens to it. If equitable partnership is a cornerstone of this successful research, how well, where are we doing well? Where could we do better? I sometimes tell the story. I once had let somebody go, a local researcher who was on a project in Uganda, and when we let him go, one of the reasons was we said, you're not proactive enough. You're not taking the lead. You're not, you're just doing what we tell you. And his response was, that's what I thought you wanted, because you have really strong ideas. And when we meet, you always seem to have the answers. So, that was a really quite a wake-up call for me to think about, how do I interact with my partners, and when do I step back? When do I step with them, and when do I slow down? Like, I have a little post-it on my computer that says, just count to 30 before you say anything. So just kind of learning to step back a little bit. So the project I want to talk about is Growing Up Great. It took place in the Democratic Republic of Congo. The idea for the research and the intervention was imported from other countries where it had been successfully implemented, but because of the donor was Gates Foundation and USAID, they wanted us, they were no longer working in those countries. So they said, that's interesting, but we want you to do it in Kinshasa. So we moved to Kinshasa, and it was a project with early adolescents to address gender equity in early adolescence to improve their sexual and reproductive health. So working with 10 to 14-year-olds. Just a quick, this is the intervention package. It rolled out at different implementation, different levels of the ecological model. And it was led by Save the Children and their local office there. But one interesting piece of this is that they did spend a year redesigning it with local government, with local teachers, with children. They set up a youth review board. So they spent a lot of time, adapting the package to fit in with, and had a lot of voices engaged in that process. The social norms that it was trying to address are the ones on this slide. And those were also identified through a participatory sort of qualitative social norms exploration process that the Save the Children staff did in the communities with their program staff and youth to identify which norms the program should address. The core consortium consisted of 2 universities, including UCSD, Save the Children, their Save the Children office in DRC, School of Public Health in Kinshasa, and another university in the US. Most of the money rested with the 2 universities, although there definitely were local partners involved. And it was a 7-year project. Again, everything on this timeline is not so important, but we spent, a year they spent a year adapting the intervention, a year in what they called a learning lab. And the learning lab was actually interesting because it was the most valuable part of this process. And it only took place because the research partner didn't have their tools ready to start. And we couldn't really justify sitting around for 7 or 8 months not doing anything. So we said, let's just try it out for 8 months and see how it works. Then we can refine it and implement it. The evaluation was part of a global study called the Global Early Adolescence Study. It consisted of 5 waves of interviews of cohort research with 10 to 14-year-olds, but it was conducted in a number of countries. So it was significantly, their pace did not keep pace with the implementation piece because they were trying to manage a global study. So that was a big challenge for us. And this, then we had implementation, we had preparation for scale up once the intervention was proven effective, and then the whole scale up phase. And this project's ending in March. During this partnership, there was no explicit interrogation of the power within our partnerships. There was a lot of challenge between the types of knowledge that we collected and what it was used for, and to what extent some of the knowledge or the evidence we were creating was actually used by the government and by the implementers. All the partners had different incentives. Do we want a brief? Do we want a publication? What language should it be in? There was a lot of, discussions and challenges around really moving that evidence into practice. The School of Public Health in Kinshasa owned the data, so that they had a lot of great involvement and ownership in that. There was a lot of value placed on the practice-based knowledge. So those are things like the community-based organization staff are noticing, problems with the caregivers attending the sessions, or there's no men showing up for the parenting session. So that was probably the most useful to the implementation. The monitoring data, of course, was interesting and important too, the reflection meetings. Then they had regular monthly learning meetings between the implementation. So all of that worked quite well, but it was pretty divorced from the other kind of quantitative data that was being collected. So the most important part of all that were the critical conversations that the stakeholders in DRC were having about the data and to apply those to their program. There was also youth-led evaluation, and which the folks in Kinshasa felt very strongly about, but and they almost wanted to rely more on those data than the data that were generated from the cohort study, the cohort survey. So there was sort of an interesting interchange between which type of knowledge is most important and most useful. Similarly, they really relied a lot on their practice-based knowledge and the monitoring data. So lots of different kinds of data, lots of different stakeholders involved in it, which was, quite interesting for the consortium. So as our outcome was scale up and institutionalization, we wanted this intervention institutionalized in the Ministry of Health, Ministry of Education. So it was clear that the government had to be involved early on. They were involved from day one. So the NGO partners, the civil society, they were all part of this. So in that case, it weren't quite well. And the intervention was embraced into the National Family Life Education Program with some adaptations that the government, wanted and needed. And then, the foundation of this work was really this adaptive management approach, but it was a continuous struggle to make sure all different forms of knowledge were kind of brought in and made accessible to people and applied to the work, as opposed to, published in a peer review article, which was also important. And a lot of that happened, but it was not really shaping the work in the country. I think that's enough for now. So I'd like to, stop there and just say that, I really appreciate this time and this opportunity for reflection. And I hope that this space gives us the chance to visualize new ways of working together and forging partnerships. And I share a quote from Bell Hooks, which says, "What we cannot imagine cannot come into being." So, really making this sort of an open space for imagining what might be and how we might do things differently.
Thank you, Rebecka, for just giving us a masterclass today. I don't think you left a stone unturned how we should be thinking about global public health work. And there were so many opportunities to reflect on what we do right here locally in San Diego and throughout the US. So very much appreciated. And the bell hooks quote, I mean, when I thought you wouldn't get any better, leave us with that. So thank you. I want to open the floor up now for questions and answers. I will maybe just kick us off, Rebecka, as people get their thoughts together. I was particularly struck by the slide that you showed around pitfalls and promises. What a fantastic reflection on, the over 30 years of work that you've been doing. And as I was looking down the very first column, I was thinking sustainability. And then, you commented on the fact that the capacity building piece hadn't really occurred to you until, later down the road. So I want to ask you to link capacity building and sustainability of the efforts that you've been up to, and maybe talk about it a little bit from the lens of how do you build capacity so that people can continue collaborations, but continue to do them in this equitable framework and sustainable framework that you've discovered through many, many years of work?
Oh, that's of course that's a big question. I think what we're seeking is to put ourselves out of a job, right? So if we're doing this work right, then and I've definitely seen that in a lot of initiatives that I've been involved with, where we're kind of no longer needed. And now you see those partners, those organizations, popping up and hiring you or, leading you. So that's exciting. I think it's slower work. So you really have to a lot of times our donors, that's not their priority. They want to see those outcomes. So if you're taking time to bring people along step by step, to have them do it rather than ourselves do it, it takes more time. And the way I'm thinking about it now, because it's a big issue in our new project, is that it has to be sort of a mentorship and coaching thing. So, rather than maybe in some cases, your partner writing the research protocol, maybe you work on it together in a write shop, or maybe you have a workshop where, you build an outline together and then you work on different sections. So I guess my reflection on this would be, it's about learning by doing, and the people who are really going to be, the organizations that are really going to gain that capacity, you have to make that a goal. You have to say, my job every day is to do this, not to get X, Y, Z done, but it's to accompany and coach and mentor my partners, which is very difficult when you have a million things you're trying to do.
Thank you for that. And maybe we'll, eventually start to see a shift in that global map that you showed about where resources go and how it flows. Richard.
Yeah, when it comes to conducting these large evaluations, oftentimes the funder has their own agenda in terms of how to evaluate the effectiveness of the program and whether things are working.
Mm-hmm.
And oftentimes so much effort and money goes into creating those metrics and evaluating those metrics, and they're not necessarily in line with what the country or the recipient finds to be important. And your example of buying a refrigerator and some signage for the offices, it kind of made me think about that. Can you speak to that a little bit?
Yeah, so there's I could give a whole other talk on just recommendations for funders. And a lot of the decolonization language or work is around recommendations for funders. So yes, I maybe should have said that. I didn't address funders at all in this, but I think there is a lot of movement and a lot of organizations that are really working to try to help funders shift, and some of them are shifting. So, and I sometimes with a lot of even just something like, let's not think about how many cool new pilots you're doing, but let's think about sustainability and scale, right? And that definitely requires a shift within the organization. So, my closest partners have been USAID, and they once asked me to help them do that. And it was like, this is a norm shift, and it has to be done from within. I can give you some ideas about how to do that, but it has to be led. We can help from an external point of view, give advice, give guidance, but it has to happen within. The donors have to, or the funders have to do it themselves. Luckily, sometimes there are funders who are very more collaborative, and we can discuss this. And I think more and more they are getting to be that way. I see Aaron has his hand up.
Hi, thank you very much for your presentation. It was an excellent overview of something that's really of interest and passion to me. I'm one of the preventive medicine students first year, and I suppose my question is, I was really glad that you talked about the knowledge gap sort of that's present in information. Has there been a movement towards open access publishing to sort of reduce the roadblocks and barriers that developing nations have to sort of be on equal footing information-wise?
I think there has been, and I think there are more journals that are more open access, but they don't tend to be highly ranked or rated. So sometimes, like when I say to somebody, I'm going to publish here, they're like, oh, no, you shouldn't do that. And I know the Gates Foundation do that. So they kind of have a sort of a blog publishing thing. So they publish, it's open access very quickly. And then the review process takes place in real time. So they'll publish, people review, then the authors will revise it. And so I think there is, I don't know a lot about it, but maybe others on this call know more about that. But I would say, just from a casual observation, that there is a movement.
Thank you.
Yeah, you're welcome. It's a great question.
Haley.
Yeah.
Hi, thank you so much, Rebecka. My question is, so in the example that you shared with us of the program, particularly one of your behavioral outcomes was a change of gender norms around certain things. And so I guess my question is more how you manage certain processes with your, across your many years of work in places that you have worked and work currently. A lot of times there are already specific gender norms around leadership that particularly favor male leadership, whether it be in academics, health professionals, even government. And so how do you honor that gender equity piece of bringing that kind of equity into your work when you are still working in those areas that kind of favor that gender norm of male leadership in those roles? How do you manage that process? Also, I guess a second part of my question is a lot of times when you're working in those areas also, there is, I know particularly in Latin America, the idea of like the testimonio where everybody in the community has big input. And so that becomes a lot of cooks in the kitchen. And so I'm just wondering how across your long career you've managed that process.
How we've managed having a lot of people, a lot of cooks in the kitchen, so to speak, a lot of
I mean,
yeah.
when you have a lot of that cultural norm of a lot of, input from the community and perspective, it just kind of creates a lot of, difficulty in managing that process. And then also the piece about how do you honor that gender?
Yeah, so the gender one is fairly straightforward because it's a very well recognized issue, and that because I work mostly in gender, sort of what we call gender transformative approaches, where we're tackling social norms and gender. So basically the idea is it has to start with your team. So your research team, your implementation team, the organization you're working with. So we build in like gender workshops on gender, self-reflection on gender. So there's usually have a couple-day workshop to start with the team. To the extent that you can get the different leadership of the organization, and it varies, right? Obviously, you want to try to do that, but at least with the team that you're working with. And then, like we did this once in a project in Uganda, they loved it. It was very eye-opening for them, but they wanted more, but we didn't have money to do more. So what we did was we built in what we call gender pulse checks. So at every meeting, at every staff meeting, we had 15 minutes or 10 minutes allotted. People would take turns to, here's an article in the paper today. What do we think about it? Just doing really rapid, and definitely, I've been very fortunate to have these longer term projects, like 5 years with consortia. So over the time, you definitely see the changes, and you'll see people say, I was telling the community they shouldn't marry their daughter or shouldn't talk to maybe about sex to their daughters. But I don't do it. They should, but I don't do it with my daughter. But you see their attitudes changing. And there's a really Care International has been a leader in this. They have a handbook called Inner Spaces, Outer Faces. And all of their staff go through this kind of gender reflection. The question about cooks in the kitchen, I don't think I've done that very well. So, I don't think I've had that many cooks in the kitchen. Most of my research has been kind of more top down. The ones who've managed that are my implementation partners, right? So Save the Children or Care, local CBOs, and they kind of, I think, are very good at that kind of community-based work and bringing in different voices. So I think maybe I'm not the right person to answer that question, except I recognize it's difficult and it's important. Yeah. There was a question in the chat I wanted to answer. It was, from Steve, could you talk about one of the major challenges when funding goes directly to a partner and accountability? I'm not, do you mean where it goes to the prime, or when it goes, that's our USAID language, for the person who gets the funds? I'm not sure I'm understanding the question exactly, but maybe it's more broadly about accountability.
No, I guess I'm just talking about potential for misusing the funds when the local partner has control and frankly, corruption issues. I come from a CDC background. I know CDC had to sort of back off from KEMRI, the KEMRI Medical Research Institute, when there were some major problems there.
Yeah, it's a great question, and I certainly don't have great answers to that. But one of the things that we're talking about is mutual accountability. So yes, your partners need to go through, those sort of vetting kind of risk management procedures, but, so should the prime, and you should report back and forth so that there's transparency both ways. And then what I've heard, the answer I've heard to that is that if you look at the list of the biggest kind of corruption and misuse of funds, they're not local partners. They're US-based and global partners who have misused the largest amount of funds. But I think, the core to your question is, yes, there still has to be, checks on accountability. And so how to do that in a way that's respectful and mutual and reciprocal and not transactional is probably the question.
Thank you.
Yeah. So, Rebecka, I think the questions seem to be slowing down here. So maybe I'll just pitch one more in there to close us out. You talked about structural things that really matter for the kind of work that we're hoping to do. One structural issue, I think, is the way we get funded in these 5-year cycles often, and what are you hearing or thinking about this? I think it's a handicap. We don't often get money for passive follow-up to do the very things that you're you were talking about keep an eye on, leadership, management, agency, voice, capacity, ecosystem. Like, are we really making a change? And we can't often see that in the 5-year cycle. Do you think that'll change?
I hope it will. I mean, so there's a lot of rhetoric about changing that right now. Whether it actually changes, I'm not sure, but I think we can all play a role in that. So I think the way we train students, the way we work with partners, the expectations that we can share with our donors. So I think it is changing, but I think it's going to require all of us and many people not on this call to keep this sort of front of mind and think about how do we build this into our work, like in an ongoing way. So it's not just, today is Decolonization Day, so how can we think about it in a way that doesn't put a huge burden on us, if our regular processes just take this into account. So it doesn't require a whole extra level of thought. But I think that's going to take, I think if the kind of efforts that are happening now continue and people continue to work on this for another 5, 6, 8 years, I think we could maybe see some sustained change. But we're all training the new leaders, right, and working with them. So there's a lot of hope there for change.
For sure. Well, I love ending on a note of hope. Thank you so much for the hometown concert. We appreciate you joining us for Grand Rounds today, and I wish you continued good luck in your work. And thanks everybody for coming, and have a great weekend.
Thanks, Sharon. Thanks, Olivia. It was just a pleasure to see you all.
Thank you. Bye, everybody.
Bye.
Thank
Take care.